All right, you do not need your papers for this because you should already know it and you're going to teach it to me. What is anaphylaxis? A severe allergic or hypersensitivity response. It's an allergic reaction to something. Yes? Okay. What is the difference between just an allergic response and anaphylaxis? Anaphylaxis is super systemic and can lead to shock. Yes? And then mods and then death. Okay. So I'm going to walk you through. I'm just going to say a couple of words and y'all are going to fill in all the important ones.
Fill in the blank.
Yeah. All right. So your patient has a peanut allergy. Cool. Then they went to Roadhouse.
Nice.
I've been to Texas.
Yeah, the rolls, cinnamon butter.
It's so good.
Yes.
You walk into Texas Roadhouse, what's all over the floor? Peanuts. Okay. So your entire body is going to go, something is majorly wrong. And it's going to immediately produce which chemical mediator?
Histamine.
Tons and tons of histamine. There's two types of histamine. Histamine 1 is
in the skin, lungs.
Like just the whole body,
okay,
right?
yeah.
Okay. Histamine 2.
That on the exam, that's mostly.
Wait,
like,
but what on the exam?
That's the gut. H2 is the gut.
What they put what on the
So
exam?
they put on the exam that like H1 works mostly in the skin and gut, or skin and
Lungs. It's got to be lungs.
And then H2 is the gut or something like
Oh,
that.
okay. So histamine 1 is outside of the stomach, right? Yes, there's going to be more skin problems, right? Because you itch. Yes. Okay. And lung because you know, have you ever go like, yeah, if you're like allergic to something, you'll go to the rodeo. I swear to God, every time I go to the rodeo, which I love the rodeo, but as soon as I walk in, I'm like, and I can't breathe because I'm allergic to like, I don't know, cow poop or something. I don't know. What is histamine 2?
Mostly in the gut.
And the stomach. Stomach. And what does it do in the stomach?
It produces like, has something to do with like acid.
Produces more acid, yeah, because it thinks, oh my God, there's a foreign invader, so I need to make more acid so I can kill it, right? But then when you have a bunch of acid in your stomach, what are you gonna do? Exactly. So some patients, when they're having an allergic response, instead of having like the hives, the pruritus, all of that, they puke, right? Like some, especially food allergies. Yeah.
Yeah.
Okay. So they all understand there's two different types of histamine. What's your keyword for histamine?
Hole poker.
Hole poker. So what does it do to your vessels?
Pokes holes.
Pokes holes. What else does it do?
Leaks into
It increases capillary permeability because it vasodilates. Was it like a throat part? It felt like a throat part. Yeah, that happens to a lot of people. Literally, that happens to me a lot. It happens to my daughter too, and she just thinks it's the most funniest thing. Yeah. Okay. So it vasodilates. It hole pokes, right? It increases capillary permeability. Yeah. That's why you get. Okay. Yes, but also your eyes get all watery and your nose starts to run, and then yes, that's a histamine response. It's one of the kids from across the way. Okay. All right. So we understand that histamine and what's happening here. All right. But in anaphylaxis, your whole body says something is wrong and you're going to vasodilate, which causes hypotension, which increases your capillary permeability. Kaylin. Okay, which increases capillary permeability, which causes you to leak into the third space, right? And that's what causes all the edema. On top of that, when you're breathing in an allergen, your lungs are like, not today, Satan. So they start to constrict. Okay, so they start to bronchoconstrict, right? That's what's going to give you wheezing. Okay, but what actually kills you from anaphylaxis? Shock. What is shock?
It's a lack of perfusion to the kidneys.
That is right. And how did we get a lack of perfusion to the kidneys?
Because
the blood pressure went so low because it's in the third space. That is called anaphylactic shock. What comes after anaphylactic shock? Multi-organ dysfunction syndrome. And then, yes. Do we understand?
Like a domino
Okay.
effect.
So indeed. So signs of anaphylaxis would be, I need the actual words. Pruritus. What are you going to see on the skin?
Red bumps, hives.
They don't come up in here saying they got the red bumps.
Urticaria.
Urticaria means hives. Okay, so we're going to see hives. So we've got swelling, pruritus, urticaria, bronchoconstriction, vasodilation, hypotension, wheezing. Zing. Okay. Have y'all seen So I Married an Axe Murder?
No.
You haven't?
That?
Oh, okay. Well, that's one of your jobs is to go and watch that show. It sounded like that movie. Y'all nobody's ever seen it?
See
Wait,
what?
what show?
So I Married an Axe Murder?
Nah.
Oh my God, it's absolutely hilarious. You have to watch it. My son and I have watched it probably like
Where is it on? I
122
wanna watch
times.
the movie
You can
tonight.
literally see it
I
on
think it's on
anything.
Amazon Prime.
Yeah.
I saw it the other day.
It's on like every movie station there ever was because it's so funny and everyone's
Alright.
seen it except for you youngins. All right. So if our biggest problems, what are our two biggest problems out of all those things? What are the two biggest problems that we've got? What's going to kill us?
Shock.
The shock. And why do we have the shock?
Because lack of perfusion. to the
Hypotension.
kidneys.
Because of hypotension. What's the second big problem that's going to kill us? Well, before that,
Shock.
like
The
what's the other issue? The
bronchoconstriction.
bronchoconstriction. All right. So what's the first thing you want to do if you even think a patient's in anaphylaxis?
Cinema. Well, no.
Give an epinephrine.
Give them epinephrine because epinephrine does two things. Number one,
Vasoconstrict.
vasoconstricts. And number two, bronchodilates. It fixes our two biggest problems that's going to kill us. Yes.
Yeah.
If I did the blood pressure of a patient anaphylactic shock, what would I expect to see?
Below 90 over
like
60.
50.
So like 80 over 40,
Yeah.
right? So we need to give epi first. And then what are you going to do?
Sit them upright.
Set 'em upright.
No, y'all
Flat.
stop that. Stop. We need to increase their blood pressure.
Oh,
So,
give them fluids.
Fluids. We're going to do fluids. And then I also have all this histamine running around. I know I came back to you. So what else are we going to give?
Antihistamine.
We're going to give an IV Benadryl, right? Or IV diphenhydramine. Yes. And then how else can we tell our immune system like you done overreacted? We're going to give IV corticosteroids. Okay. And move from there. Okay. But when a patient is in shock, you do not want to sit them upright, correct?
Oh,
Right.
because that would
Right.
make
You put them in
yeah.
modified Trendelenburgs where you lay them flat with their legs elevated.
It's because all the like from their head, right?
What?
Like all that.
When they're in shock, because you need their blood to their heart. If you sit them upright, it's going to go down to their
Yeah.
extremities, right? Now, respiratory patients, I think that's what y'all are thinking. All
Yeah,
respiratory patients
yeah.
get sat upright.
But
But remember, y'all, the respiratory thing is not what's going to kill them. It's the
I
hypotension.
was thinking.
That's why we do epi first.
Because I know asthma, you sit 'em upright.
Okay.
And exacerbation.
All right. Do you understand how the whole anaphylaxis thing works?
Yeah.
All right. I think you do.
Yes, sir.